Hi, I'm Dr. Harry Adelson. I'm coming to you from Docere Clinics here in Park City, Utah. Today's question is, what is the best age to receive stem cell therapy? Well, if you had asked me that before 2017, I would have said under the age of 50. But now I would tell you it doesn't really matter. Let me tell you why. Before 2017, I was only using autologous stem cells. I was using stem cells from people's own bone marrow combined with stem cells from their fat. And what I found was for the people, sort of the under 50 crowd, I got consistently good results. I didn't help everybody, but we helped way more people than we didn't help. The over 50 crowd, and especially when you get into sort of the over 65 crowd, I found that it was more hit or miss. Sometimes it would work very well, but I had a higher non-responder rate. So that's why I'm saying if you asked me before 2017, I would give you an age cutoff. However, that's changed. And the reason is I've started using exosomes. I still use people's own bone marrow and fat stem cells, but then we supplement with the exosomes. What makes somebody's stem cell old is as we age, our own stem cells lose the ability to manufacture these vesicles filled with growth factors. They're also called extracellular vesicles, which are in fact the active ingredient of stem cells. When we talk about stem cells' ability to heal surrounding tissue, that's also called the paracrine effect or paracrine signaling. Well, paracrine signaling is dependent entirely on the production and excretion of exosomes. So if your stem cells are deficient in exosomes, you're not going to have a great healing response. What I found is when we take somebody's own bone marrow and fat stem cells and then we supplement with these very robust placental exosomes, what we think is happening is our own stem cells absorb the exosomes into themselves, thereby functionally making your stem cell that of a younger person. That's been my experience clinically. I found that once I started adding the exosomes, that non-responder rate over the age of 50 and especially over the age of 65 kind of stopped happening. The older people started reacting like younger people. The other thing that I really noticed when I started using exosomes is a dramatic reduction in post-injection soreness. Here at Docere Clinics, we use IV sedation given by an anesthesiologist or nurse anesthetist for all our cases. When people would wake up from a procedure, about 1 in 10, 1 in 20 times, they'd wake up with a lot of pain. Well, when we started using exosomes, that pretty much entirely stopped happening. It's very unusual for someone to wake up with a lot of post-procedure pain, and we think it's because of the strong anti-inflammatory property of the exosome. So I mentioned placental exosomes. Now keep in mind, these have nothing to do with embryos. These are women who give birth to a normal baby, and then they donate the placenta, the umbilical cord, and the amniotic membrane so laboratories can harvest the stem cells from those tissues. If you'd like to learn more about how we practice stem cell medicine here at Docere Clinics, have a look at the link below. It'll take you to my film, The Stem Cell Solution. It's free to watch, and I hope you enjoy it.